Do you suffer from the hot flashes of menopause? Do you know anyone going through this phase? You surely have heard that the symptoms of menopause aren't the most pleasant, right? Menopause occurs when a woman hasn't menstruated in 12 consecutive months and can no longer become pregnant naturally. It usually begins between the ages of 45 and 55, but can develop before or after this age range. Menopause can cause uncomfortable symptoms, such as hot flashes and weight gain. For most women, medical treatment isn't needed for menopause. Most women first begin developing menopause symptoms about 4 years before their last period. Symptoms often continue until about 4 years after a woman's last period. A small number of women experience menopause symptoms for up to a decade before menopause actually occurs, and 1 in 10 women experience menopausal symptoms for 12 years following their last period. There are many factors that help determine when you'll begin menopause, including genetics and ovary health. Perimenopause occurs before menopause. Perimenopause is a time when your hormones begin to change in preparation for menopause. It can last anywhere from a few months to several years. Many women begin perimenopause some point after their mid-40s. Other women skip perimenopause and enter menopause suddenly. About 1% of women begin menopause before the age of 40, which is called premature menopause or primary ovarian insufficiency. About 5% of women undergo menopause between the ages of 40 and 45. This is referred to as early menopause. Every woman's menopause experience is unique. Symptoms are usually more severe when menopause occurs suddenly or over a shorter period of time. Now let's check these herbal remedies, which are your best bet for dealing with everything from hot flashes to irregular periods. 1. Black Cohosh for hot flashes. When it comes to natural treatments for menopause symptoms, black Cohosh is probably the most studied and most effective herbal remedy. Almost all clinical studies on this herb use a standardized extract, either remifemin or climidinin. 3 out of 4 well-designed clinical trials found these remedies effective for treating hot flashes. They may even be appropriate for women who have had estrogen-sensitive breast cancer who can't take hormone therapy. But be patient. It may take 6 to 8 weeks before you see full results. 2. Chaste tree berry extract for irregular periods. This herb helps regulate menstruation. Some patients say it also has a positive effect on their libido, while some studies suggest it may help relieve breast pain. Chaste tree berry is thought to work by increasing progesterone levels, which helps prevent the heavy menstrual cycles so common during menopause. There are really no good clinical studies on its use, but integrative practitioners have had years of positive results using it. This herb is also helpful if you develop PMS as part of your perimenopause. 3. Wild Yam Cream. Despite the hype, this cream does not contain progesterone and cannot be used during menopause as a replacement for progesterone. However, it is often used in herbal medicine to heal wounds, and can help with the irritation and pain that often results from vaginal dryness, protecting the vagina from tears. 4. Ginkgo for forgetfulness. Ginkgo is one of the best herbs to take at this time, as it appears to help mental functioning by improving blood flow and protecting blood vessels. Take 60 milligrams of standardized ginkgo extract once or twice a day. 5. Sage tea for night sweats. This is a traditional remedy that many women find helpful. Pour 8 ounces of boiling water over 2 to 3 teaspoons of the fresh herb and steep for 10 minutes. Strain and, if necessary, add a small amount of honey to taste. Sip 1 cup several times during the day, especially in the evenings, to help with nighttime flashes and sweats. 6. Soy. Menopausal women in the US are over 8 times more likely to have hot flashes than women in Asian countries. Could the soy in the Asian diet explain the difference? Possibly. Studies have found soy to be modestly effective in relieving hot flashes. Soy foods, such as soy nuts and tofu, and phytoestrogen supplements, estrogen-like compounds found in some plants, are sometimes used to relieve mild hot flashes. 7. Flaxseed. Flax is a power-packed little seed. It's full of omega-3s, fiber, phytoestrogens, and B vitamins. One small study of 140 women found decreased menopause symptoms and improved quality of life after 3 months of flaxseed consumption. Another study found links between flaxseed consumption and a reduction in hot flashes. 8. Oatmeal. There's a reason why oatmeal is the breakfast of champions for so many people. Not only are oats an affordable health food, but they can also prevent diabetes, high cholesterol, weight gain, inflammation, and constipation. Oatmeal is another healthy carb that can help keep energy levels steady during menopause. Plus, oatmeal is the perfect vehicle for incorporating a host of other menopause-friendly foods like berries, flax, and yogurt. 9. Salmon. Salmon is rich in both vitamin D and omega-3 fats, two nutrients that are even more essential during menopause. While more research needs to be done, omega-3 fatty acids are linked to reducing night sweats and breast cancer risk. One study shows omega-3s are beneficial as women ease out of menopause as well. 10. Leafy greens. There are a million reasons to eat leafy greens, especially if you're experiencing menopause. Cruciferous veggie consumption is linked to longevity and is a great way to pack in several hard-to-obtain nutrients like calcium, magnesium, potassium, B vitamins, and fiber. All of these nutrients are essential for health in menopause as calcium and potassium keep bones and muscles strong, B vitamins and fiber help prevent weight gain, and magnesium and B vitamins regulate our energy levels and moods. Try this remedies and share your experience with us.